Hello and welcome. We are so glad you're here, taking this step in your best possible health.
Here's a look at what you can expect during your first mammogram.
There's not a lot of preparation you need to know before your first mammogram. Things you do know. First, relax. We're going to take great care of you. Second, wear an outfit that's easy to disrobe from the waist up. And finally, don't wear deodorants or lotions on the day of your mammogram. This is because one of the early signs of breast cancer we're looking for are little tiny flecks of calcium.
Metal particles from lotions and deodorants can show up on your mammogram, and they can mimic these tiny flecks of calcium.
When you get here, we're going to ask you to fill out some paperwork. Why do we ask all of those questions, you may wonder? Here at Diagnostic Imaging Centers, we estimate your lifetime risk for breast cancer using the Gail Model. Using this estimated risk and your breast density that we see on your mammogram, we make recommendations for what's the best way for you to screen for breast cancer. The Gail Model uses lots of information, including the age that you had your first period, the age you had your child, your race and ethnicity. All of that information is calculated into your lifetime risk. An average risk is going to be something less than 10%. If you're over 10%, we may recommend additional screening for you, again, depending on your breast density. That can include things like breast ultrasound or breast MRI.
Let's talk a little bit about a screening mammogram versus a diagnostic mammogram. A screening mammogram is for you if you have no new or concerning symptoms. This is your annual screening when everything is exactly like it normally is. You do not need an order from your doctor for a screening mammogram.
A diagnostic mammogram is needed if you have a new breast sign or symptom. That includes things like a lump or a change in breast size or shape or a breast discharge. That means something leaking from the nipple. If you have any of those changes, we're going to want to do a diagnostic mammogram, and that means you will need an order from your doctor's office.
Here's an idea of how the exam will go. The amount of time you're in the room is minimal. We will take 4 pictures, 2 on each breast. After your mammogram, the technologist will take you back to your dressing room, and we will submit the images for the radiologist to read. The typical wait time is short while the doctor looks over your images, and the technologist will be back with your results.
At times, your radiologist may want to take a closer look at something on your screening mammogram. So the first thing to remember is breathe and relax. The majority of the time, those workup images show normal tissue and nothing to worry about. If we do need additional images, we can actually do those the same day as your mammogram. Here at Diagnostic Imaging Centers, we'll work you back in for additional mammogram views or a breast ultrasound if you need it, and you'll leave our office with your results. Those extra views, again, are most likely going to show something normal. The majority of women who come in for their screening mammogram are going to have normal benign results. One frequent question we get is, should I have a 3D mammogram or a 2D mammogram? In a 2D mammogram, we're taking a 2-dimensional picture of your breast, so all of your breast tissue from skin to skin overlaps. In a 3D mammogram, we take several projections and a computer creates 1 millimeter thin slices all the way through your breast tissue, so I can look at the tissue without overlap. This does 2 things. First, it allows us to find small breast cancers without overlying breast tissue, so we find more small cancers more frequently. The other benefit is not having to do workup mammograms as frequently as we do when we do a 2D mammogram. With 3D mammography, we're finding breast cancers more frequently when they're at a smaller size and a more easily treated stage. Thank you for taking this time to learn about your best possible breast health.
We hope we've eased some of your concerns about your first mammogram, or your second, or your 20th.
And remember, share this with the women in your lives. You may be the voice that gets someone to go get their screening mammogram, a potentially life-saving screening.